Hello, today I'm here to talk about common problems during pregnancy. Morning sickness is one of them, which comprises of nausea and vomiting. Nausea is feeling that you are going to throw up, and vomiting is exactly if you are throwing up. Other problems are indigestion, acidity, excessive salivation, flatulence and burping, and distaste of mouth. We know that morning sickness is a common problem during pregnancy. It usually starts around 6th week of pregnancy and clears up by 16th to 20th week of pregnancy. This happens due to hormones produced during pregnancy. Although it's called morning sickness, but this can happen throughout the day, even at night. Now let's talk about how to handle it and other problems which I mentioned earlier. There are some points which need to be considered and followed. First of all, eat small meals so that your stomach is not empty. So, that is the key actually. This will minimize nausea and vomiting. Don't keep your stomach empty, especially in the morning when you wake up. Try to at least eat some toasted bread or some cereal on its own. You can also try pretzels, some lightly salted crisps, tortilla chips, potato chips, donuts, plain Madeira cakes, or even boiled potatoes. Most of the diet is composed of carbohydrates and can be used throughout the day. Eat fruits as you can tolerate. Sometimes oranges can cause acidity. Grapes take time to digest and remain for long in the stomach and again cause acidity. Apples can also cause acidity. Apples can also cause diarrhea or constipation, depending on how you react to them. Try to avoid pineapple and papayas, as both of them can stimulate uterine contractions, and there is risk of miscarriage or early labor. However, if you develop acidity, then you can try milkshakes, custards, or ice creams. Bananas and cucumber also absorb stomach acid and neutralize it and help with acidity. Just to let you know, watch your banana intake as it can cause flatulence and burping as well. Avoid spicy food and eat the spice as you can tolerate. White chocolate also helps with acidity. Eat your dinner at least 3 hours before going to bed. Lay down excuse me, lay down on your left side so that stomach contents don't come up to mouth. Introduce other foods like chicken soup and Chinese rice as these are not spicy. You can avoid vegetables in Chinese rice and corn and egg in chicken corn soup. If the problem of burping or flatulence is coexisting with acidity. Nuts can also cause flatulence and burping, so try to avoid them if you are experiencing it. Carbonated drinks in moderation can help with indigestion, but prefer the ones which do not contain caffeine because caffeine again will give rise to acidity. Keep yourself hydrated. If you don't drink enough, then dehydration causes rise in urea, which causes distaste of mouth, and this leads to difficulty in tolerating food as well because you don't like the taste, so you won't eat it. Pregnancy itself also causes distaste of mouth. Water intake also maintains blood pressure, and if you don't drink enough water, then you may develop dizziness. If you develop excessive salivation, then you can try mint toffees, butter candies, or even fruit toffees. But be mindful that any of these can cause acidity as well. So see how your body responds to them. These candies also help with nausea. Keep moving as this helps things going and this prevents clot formation during pregnancy. Reduced activity makes you prone to develop the clot, and pregnancy itself adds risk to it. Stop smoking and alcohol intake. Reduce your caffeine and tea intake, and if you can stop taking it, that would be the best. If symptoms still persist, you may need medications, so seek medical help and stay healthy. I hope this information helps you to make your time of pregnancy better and more tolerable. Thank you for watching and listening. Bye.